Is a hearing on House Bill 2284. Do we have a reviser's report? Thank you.
Good afternoon, committee. House Bill 2284 directs the Department of Administration to adopt written policies governing the negotiated procurement of managed care organizations to provide state Medicaid services pursuant to a contract with the Kansas Program of Medical Assistance. Section 1B states that such policy shall include a prohibition on the destruction of records, an adoption of a tie-break procedure if the evaluation process involves scoring by individuals or committees, and a requirement to be transparent with the legislature during each step of the procurement process. Section 1C states that the policy shall be adopted and implemented prior to July 1st, 2026. House Bill 2284 would take effect on July 1st, 2025 after its publication in the statute book.
Any questions for the reviser? Very good. Thank you very much. For the proponents, I believe we have Representative Will Carpenter. Welcome to committee.
Thank you, Mr. Thank you, Mr. Chairman Bryce and committee members. It's good to be before you today. I stand before you as a proponent of this bill. I was involved in the procurement process for the latest MCO contracts. I and many members of the CanCare Oversight Committee members saw the need for the oversight of the process in selecting our managed care organizations. These contracts total about $4 billion. And with that, I'd stand for questions.
Very good. Any questions, committee? Yes, Representative Meyer.
Thank you, Mr. Chair, and hello, Mr. Chair. I'm a little bit unfamiliar with the process. Would you mind explaining kind of what that procurement process looks like and the need for oversight?
We only have an hour-and-a-half committee, and it would take me a long time to get into that process. It's very complicated. I think the major thing that we're trying to establish here is more about transparency. There was a lot of things, and some of you that followed this, there was documents that were deleted, there was just all kinds of lack of transparency. And the first time, it's their fault. Second time, it's ours. So this just basically cleans up, mainly adds transparency to the process, and also, yeah, and that, yeah. I can't discuss something else yet.
No, thank you.
Committee. Oh,
Committee, any other questions? Will the conferee settle down a little bit? Any other questions? Okay. Thank you, sir. Thank you for your testimony.
Thank you, committee.
Is there any other discussion? Seeing none, we will close the hearing on House Bill 2284. Thank you.
Very good. Thank you, Mr. Chairman. And if I can find my papers here, I'll open the hearing on 2219. So I'm going to go ahead and open, and if Carly will give us an overview.
Thank you, Mr. Chair. Committee, House Bill 2219 enacts the Physician Assistant Licensure Compact to provide interstate practice privileges for physician assistants. Section 1 states that the purpose of the compact, which is to enhance the portability of a license to practice as a physician assistant while safeguarding the safety of patients. Section 2 provides definitions for terms used throughout the compact. Section 3 sets out the criteria for states to participate in the compact. These include that the member state licensed PAs have a mechanism in place to receive and investigate complaints, fully implement criminal background check requirements, and utilize passage of a recognized national licensure examination as a requirement for PA licensure. Section 4 sets out the criteria for PAs to receive a multi-state license. These include graduating from an accredited PA program, holding current certifications, having no felony or misdemeanor convictions, and no revocation of a license or restriction on a license due to adverse action. Section 5 requires a licensee, when applying for a compact privilege, to identify the participating state from which the licensee is applying. Section 6 permits a participating state to impose adverse action against a licensee in that state. Section 7 provides for the establishment and operation of the PA Licensure Compact Commission, its composition, powers, and financing. Section 8 requires the Commission to develop and use a coordinated data and reporting system containing license and adverse action information on licensed PAs. A participating state is required to submit a uniform data set to the Commission with the information on all PAs in the compact. Section 9 requires the Commission adopt rules and regulations to implement and administer the provision of the compact. Section 10 sets out rules for oversight, dispute resolution, and enforcement of the compact. Section 11 states that the effective date of the Commission is upon passage in the 7th member state. Procedures for a state's withdrawal and amendment of the compact are also provided. Section 12 contains a severability clause, which gives instructions to a court interpreting the compact if a provision is held unconstitutional. Section 13 provides that nothing in this compact is to prevent or inhibit the enforcement of any other law or regulation in a participating state. House Bill 2219 would take effect after its publication in the statute book on July 1st, 2025. Stand for questions.
Thank you, Carly. Committee, questions? Very good. Thank you very much. First proponent we have is Michelle. Michelle, are you virtual? Can you hear us?
Can you hear me?
We can.
Thank you. Chairman Carpenter, honorable committee members, my name is Michelle Richert. I am the Midwest Region Liaison with the United States Department of Defense, specifically the State Liaison Office. We operate under the direction of the Undersecretary of Defense for Personnel and Readiness. We stand in support of the Physician Assistant Occupational Compact and the policies reflected in House Bill 2219. This policy, our proposed policy change, addresses licensing issues affecting our service members and their families. Licensure issues for both our transitioning military members and their spouses have been a priority for the department for several years. Occupational licensure compacts provide consistent rules that allow licensed members to practice in other states through privilege to practice policies or to transfer their license more easily to a new state. The military provisions added to these compacts assist military members and their spouses to participate. As our military families and family members move from state to state, obtaining licenses for employment is very important. Military spouse unemployment is approximately 21%, much higher than the national average. These compacts will serve to relieve one of the many stressors of a military move and support military families' financial and personal well-being, in addition to add to the mission readiness of our armed forces. We are grateful for the tremendous effort that Kansas has historically made to support our military members and their families, and appreciate the opportunity to support the PA Licensure Compact. Thank you again for your support on this issue, and I stand by for any questions that you may have. Thank you.
Very good. Thank you, Michelle. Committee, questions of Michelle? Seeing none. Okay, next we have Lieutenant Colonel Keith. Welcome to committee.
Thank you, Mr. Chairman, members of the committee. Lieutenant Colonel Keith Marshall with the Adjutant General's Department. The previous conferee, my colleague, has a lot of the same talking points that I do, so I won't belabor that. You have my written testimony. I will just say that the Adjutant General's Department and the Kansas National Guard stand in support of this licensing compact, similar to the three that we already testified in support of for dietitians, school psychologists, and cosmetologists. And I just hope the committee will see fit to support this one as well. And with that, Mr. Chairman, I will stand for questions.
Committee questions? Seeing none? Seems like we've been here before.
Yes, sir. Thank you, Mr. Chairman.
Thank you. Next, we have William. William, welcome to committee.
Good afternoon, Mr. Chairman, members of the committee. My name is William Wilk. Here today on behalf of the Kansas Chamber of Commerce. I'll just keep it brief, pretty much my testimony from last week on the last three compacts. But on this one, as I mentioned last week, it's important that this language remains the same for what is passed in other states. So with that, I would like to offer two friendly amendments to the committee. First being in Section 3A5, deleting the word examination and replacing it with by its licensing board receiving. This section should read as fully implement a criminal background check requirement within a time frame established by commission rule by its licensing board receiving the results of a criminal background check and reporting to the commission whether the applicant for licensure has been granted a license. And then secondly, in Section 7, page 10, line 33, simply deleting the word contract and replacing it with compact to read, "and such compact privileges associated fees shall be governed as follows." With that, we just view these compacts as a necessary step to increase access to physician associates for Kansans and fast track the licensing process for military spouses. So with that, I'm happy to stand for any questions.
Committee questions? Representative McDonald.
Thank you, Mr. Chair. I missed that last one that you said. I was trying to find it. Could you repeat where
On
it
the
was?
Second Amendment, it's just simply in Section 7, page 10, line 33, deleting contract and replacing it with compact.
And committee, just for reference, these errors were caught in the Senate portion of this.
Correct. Yeah.
So we'll be, when we work the bill, we do have the amendments ready for everyone. So very good. Committee questions of William? Seeing none, thank you.
Thank you.
Next, we have Kirsten Stevens. Kirsten, welcome to committee.
Committee. Thank you for the opportunity to speak before you today. I am Kirsten Stevens, a Kansas PA for greater than 20 years, and here on behalf of the Kansas Academy of Physician Associates to express strong support for House Bill 2219, the Physician Assistant Licensure Compact. I'd like to briefly address the recent name change for our organization. CAPA is a constituent organization of the American Academy of Physician Associates, and AAPA has undergone a rebranding initiative to better reflect the evolving role of PAs. The effort culminated in a legal name change for the organization to more accurately represent the profession. It can be confusing. Just know in Kansas, PAs will continue to use the title physician assistant or PA in clinical settings until a formal change is statutorily enacted. Regarding House Bill 2219, the PA Licensure Compact will streamline the process for attracting highly qualified healthcare professionals who wish to relocate to the state or expand patient services. Portability is important, and you heard other testimony about that. The compact benefits patients through increased access to care and improved continuity of care, increasing the availability of providers in underserved areas. The compact establishes a multi-state data system, enhancing public protection by sharing licensure and disciplinary information across member states. To qualify, patients must hold an active, unrestricted license in a member state and meet essential state-specific eligibility standards in the state where patient care is provided. We would like to emphasize the PA Compact does not alter or extend the scope of practice for PAs practicing in Kansas. The compact preserves the existing state authority. Passing the legislation will allow Kansas to join 13 other states already participating in the compact and at least 10 others considering the initiative. I will note that we support the two friendly amendments. Kansas Academy of Physician Associates encourages the committee to support House Bill 2219. Thank you for your consideration, and I will stand by for questions.
Very good. Committee, questions of Kirsten? Thank you very much.
Thank you.
Committee, I'll bring your attention to written-only proponent testimony from Kevin Harper, Teledoc, Tara Mays, Vice President of State Legislative Affairs, Kansas Hospital Association, and Christine Christina Abram from the Greater Kansas City Chamber. I'll go ahead and close the hearing on 2219. We will open, in the interest of proponents, we will go ahead and open the hearing on just a little bit out of line here because one of our other proponents is testifying in another committee. So we're going to go ahead and open the hearing on 2307. And with that, Carly will give us a overview. Thank you, Carly.
Mr. Chair, Committee, House Bill 2307 transfers the power to authorize and oversee certain activities regarding prenatal and postnatal diagnosed condition awareness programs from the Department of Health and Environment to the Kansas Council on Developmental Disabilities. Section 1 transfers the powers, duties, and functions of prenatally and postnatally diagnosed condition awareness programs as provided in KSA 65-1259 from the Department of Health and Environment to the Kansas Council on Developmental Disabilities. Section 2 amends KSA 65-1259 to reflect the transfer from the Department of Health and Environment to the Kansas Council on Developmental Disabilities. Section 2G1 establishes in the State Treasury the Prenatally and Postnatally Diagnosed Condition Awareness Programs Fund. Section 2G2 states that on July 1st, 2025, the Director of Accounts and Reports shall transfer $25,000 from the State General Fund to the Prenatally and Postnatally Diagnosed Conditions Awareness Programs Fund. House Bill 2307 would take effect on July 1st, 2025, after its publication in the statute book.
Good. Thank you, Carly. Committee questions? Seeing none, thank you very much. First proponent is Lola Colonel, and she is virtual. Lola, can you hear us?
Yes, can you hear me?
We can.
Okay. Good afternoon, Chairman Carpenter and members of the committee. I am Lola Cornell and a peacemaker. I am also the advocacy coordinator for the Kansas Council on Developmental Disabilities and attend college. I work for the Chiefs and the Royals as a greeter in a fancy suite, and I am currently in a world premiere musical called Just Ask, based on a book written by Supreme Court Justice Sonia Sotomayor about people with disabilities. I even got to meet her twice. First of all, Mr. Chairman, thank you for your unwavering support of Kansans with disabilities. Your continued fight to end the waitlist is appreciated by me and our entire KCDD family. As you know, KCDD's mission is to empower individuals with IDD and their families to lead systems change, build capacity, and advocate for inclusive, integrated, and accessible communities where everyone belongs and thrives. You all probably know our small but mighty team of Wick Downing, myself, Allison McCain, and Sarah Hart-Weir. On behalf of KCDD, I would like to express my support for House Bill 2307, Prenatal and Postnatal Diagnosed Conditions Awareness. Current evidence-based information must be collected, synthesized, and disseminated to the parents in our state. Information that celebrates the life of their baby and gives hope, not just facts focused on challenges. This is important to me because my mom was encouraged to have amniocentesis, with termination assumed if a diagnosis was found. There was no clarification on miscarriage or other risks. When my mom asked, the healthcare counselor said, "Yes, there are risks, but there is a greater risk of having a child with a disability." What? That's a risk? This comparison does not make sense. At birth, my diagnosis of Down syndrome did not come from a doctor and was unprofessional. Even after I was born, doctors made false assumptions. One doctor was surprised when I was well adjusted and able to learn, saying to my mom, "She can read?" Obviously, the doctor had dated information about Down syndrome. Yes, I can read, and write and work and learn French. Parlez-vous français, mes amis? And learn algebra. Although algebra is not my favorite, while being happy and successful in my life. That's why this bill matters. And KCDD is committed to ensuring that this bill gets implemented the right way. Parents need real, hopeful information. In my testimony, I highlight the key benefits of House Bill 2307. Please support this bill so people like me know we matter and parents can get the information they need to understand and celebrate their children's unique abilities. When I was in high school, I was fully included and made a difference in others' lives. And I was voted the most likely to brighten someone's day. People with disabilities are kind to others, but have to work hard to accomplish their goals. This is what the world needs now. It needs kindness and people to brighten each other's days. I'll stand for questions at the appropriate time. Thank you.
Lola, thank you so much for that. Committee questions? You did such a good job. There are no questions. So thank you very much. Next, we have Jeannie. Jeannie, come on up. That is going to be a tough act to follow.
That's exactly what I was going to say. How do I follow Lola? Just beautiful. Mr. Chairman, members of the committee, I'm Jean Gowden, Director of Government Relations with Kansans for Life, and it is an honor to be able to stand here in front of you supporting House Bill 2307, Prenatal and Postnatal Diagnosed Conditions Awareness Program. The fact that the Kansas Council on Developmental Disabilities is willing and able to have the power to oversee and authorize this program just makes absolute sense. The KCDD is uniquely qualified to fulfill this role because it understands what individuals with disabilities and their families truly need. It's experienced in providing critical information and support to those families and has well-established partnerships with medical professionals and other support organizations. Kansans for Life is confident that Kansas families who are facing challenges that come with prenatal or postnatal diagnosed conditions will be well served by the KCDD's implementation of the important program. I respectfully ask that the committee find House Bill 2307 favorable for passage, and I stand for questions.
Committee questions of Jeannie? Very good. Thank you. Seeing none. Scott Brackett. Scott, can you hear us?
Yes, can you hear me?
We can.
All right. Well, hello there. My name is Scotty Brackett. I am a parent advocate for Down syndrome. Thank you to the committee for allowing me to share my story today in support of the Prenatal Postnatal Diagnosis Information Act and how it could have made a difference in my family. In 2016, I was pregnant and was due to have a boy in April. And I had my 20-week ultrasound at around 20 weeks. And they noticed something on his heart that looked abnormal. Everything else looked pretty good. And so we briefly spoke to a genetic counselor. After I had my ultrasound, they took us into a different room. I briefly spoke to a genetic counselor. She gave me and my husband our risk for different conditions and different trisomies, including trisomy 13, 18, and 21, with trisomy 21 being Down syndrome. And at that time, we had set up a plan to deliver the results. I had chosen to get an amniocentesis that day, and we developed a written plan to deliver the results. The plan was that they were supposed to call my husband. I'm a nurse practitioner, and so I work clinically and see patients. So I just I'm not very readily available during the day to take phone calls, but my husband is. So the plan was for her to call him with the results. And we also signed a form the genetic counselor and us agreeing to this plan. We also said that she could leave a voicemail with results. Um, and so with either positive or negative results. And so about a week later, I was at work and I missed a phone call. I only missed it by a few minutes. And so it was a message from the genetic counselor asking me to call her back. I immediately called her back within about 2 or 3 minutes of her phone call, and she didn't answer. I left a message and I just couldn't sit there waiting for the results. So I repeatedly called for the next 30 minutes and left multiple voicemails, and she never called me back. And that was around 11 o'clock on a Wednesday. She didn't call my husband at all, and did not follow our written signed plan. This made me very suspicious as to what the results were and left us a completely sleepless night waiting for those results. And the next day she called, it wasn't until I was leaving work and it was 5:06 p.m. in the evening when she called. I waited that whole day. And she returned my call. She asked me, "What are you doing?" At that time, I was driving down the highway on my way to pick up my other children from school or from daycare. And so she asked me what I was doing. I said that I was driving on the highway. And she just very abruptly said, "Well, they're not the results that we were hoping for. We found a third copy on chromosome 21." And I immediately began crying. Um, and she just very briefly said, "I can tell you're upset and I will call you back tomorrow," and hung up the phone. The entire phone call was 27 seconds long to deliver a life-changing diagnosis. She did it while I was driving down the highway she just demonstrated very little concern for my physical or emotional well-being. And this put me in a very dangerous situation. And she never called me back, ever. Not the next day, not the next week, never. And so having gone through that experience and hearing other parents of children with Down syndrome having similar experiences to mine, I'm confident that this act will help families and caregivers, just help them receive accurate and up-to-date information. And I strongly believe that this is the right approach so that the family is cared for in a way that supports their decisions and supports their values. And the KCDD has been very helpful in leading these efforts. And so, yes, thank you for allowing me to share my story, and I'm available for any questions.
Very good, Scotty. Thank you for that. Questions? Seeing none, thank you again for being here.
Thank you.
Next, we have Mike Burgess. Mike, in person.
Well, thank you, Mr. Chair. And as the chair said, I'm Mike Burgess with the Disability Rights Center of Kansas. And I love when I can go towards the end after other great proponents explain the need, so I can say us too. As you can hear, there is a tremendous need for this. There are a significant amount of resources that help individuals with disabilities throughout their entire lives. When a family first gets that diagnosis, this is overwhelming, and it's hard to kind of think down the road. And so having that good information to help the families to be able to accept that and understand that diagnosis and what the tremendous value that their sons and daughters can add to this world and the supports to help them do that is so important. So with that, we're happy to share our support for this bill, and be happy to stand for questions at the appropriate time.
Committee questions of Mike. Representative Weichel.
Thank you, Mr. Chairman. Thank you, Mr. Burgess. I'm hoping you can help draw some connections here. So we just heard the prior conferee share her story. If I had been I've had 20-week ultrasounds, if I had received news that I wasn't expecting, how do they get connected with the services we're talking about in this bill, right? Do they have to seek out information, or how's the connection made?
Sure, and I think the DD Council can definitely articulate more on this, but for full disclosure, we have a seat on the council as the protection and advocacy entity, so I attend those meetings. So they have a working group that includes healthcare practitioners, families, and a number of groups, and they work on these kinds of issues on a variety of things. There's another bill that was heard as a result of that working group. They also, as a DD council, they do grants and work to bring in partners to help do those things. And so it's my understanding that this would likely be, part of it would be in addition to the coordination activities, but they would bring in some other partners to help with that as well. So, but the DD council is free to correct me if I said anything that isn't aligned with what their plan is.
Did that answer your question, Representative? Very good. Committee, further questions? Representative Bryce.
Thank you, Mr. Chairman. Thank you, Mr. Burgess. Just had a question. It seems like it's been presented that this law would provide more accurate information, and also it's been said that it will be more supportive of people going through these rough times. What do you see as the problem really being solved by doing this bill? Thank you.
Well, so KDHE does a lot of amazing things and wonderful, important things. I think when you look at these specific programs, the DD Council will be a better fit and be able to take this on in a significant way. I mean, there are a lot of things that KDHE gets asked to do and that they have to do. This was an optional thing previously. With the council, it will be it's the law changes it to shall, and the council is equipped to be able to take this on, and it will be a significant priority for them as well. If that hopefully answers your question.
Committee, further questions? Representative Reeves.
Thank you, Mike. I just, one more question about the process. So if the diagnosis is given, then what happens next is the family's information sent to the council and the council contacts the family, or how does the family know about the council?
So I have not had the conversations around that, but I can say at a general level, I believe the council would create these resources and then use their partnerships to help disseminate that to healthcare providers and others. So I don't think the council will be directly, they're kind of the tool to help make it happen, if that makes sense, as opposed to the one delivering the news specifically.
Representative Howell.
Thank you, Chair. Thank you for being here, Mike. Would you say that it would be a fair description to say that the KDHE, by nature of all the many responsibilities that they have, is trying to, they have to approach from a very broad sense because they have many responsibilities, but the KDD has a more focused, narrowed attention, and so they would be able to be more supportive in a very specific way to assist these families and provide the needed attention that they need.
Yes, I mean, and the members of the council, they have a specific requirement to have so many individuals with disabilities and family members of individuals with disabilities. So they're, by nature of it, there are individuals who have directly been impacted by this. And so I think from that perspective, it is a great fit to put it with the council. And it's a state entity. There's a DD council in every state and territory. In Kansas, there are a handful of specific members, including somebody from DCF, somebody from KDADS. We have the PNA, so somebody DRC, and somebody from the KU Center on Disabilities. And then the rest of the members are appointed by the governor with the bylaws and a strong governance model. So this isn't just a random organization by any means. I mean, it is a real entity who's well-positioned to be able to do this.
Any further questions?
Hi.
Thank you, Mike.
Oh, excuse me. Hi, this is Allison from the Kansas Council on Developmental Disabilities. Could I provide a brief statement just giving a little bit more information to those questions?
Yes, you may.
Thank you. Thanks, Mike, for answering those questions. As the DD Council, we work on our Health Equity Coalition with a number of healthcare providers to ensure best practices. And I think part of this bill would ensure that we have a training program for healthcare providers on how to give the news of a diagnosis to families, as well as the development of a resource hotline and programs to support peer-to-peer support for families and mothers expecting.
Very good. Thank you for that. Committee, further questions of someone from the Disabilities Council? Very good. Thank you. Thank you very much for clarifying that.
Thank you.
Okay, committee, I'll bring your attention to written-only testimony from Lucretia and Brittany. And with that, I'll close the hearing on 2307, and I will open the hearing on 2249. Carly, you're up.
Thank you, Mr. Chair. Committee, House Bill 2249 requires the Secretary for Aging and Disability Services to grant physical environment waivers for certain rural emergency hospitals to provide skilled nursing facility care. House Bill 2249 creates a new section of law that would require the Secretary for Aging and Disability Services to grant a physical environment waiver for existing nursing facilities to an applying rural emergency hospital to transition up to 10 swing beds into skilled nursing facility beds if the facility, 1, is currently licensed as a rural emergency hospital, 2, was licensed as a hospital immediately prior to its designation as a rural emergency hospital, and 3, during the facility's licensure as a hospital, the facility provided skilled nursing facilities services or critical access hospital swing bed services for at least 1 year without a finding of immediate jeopardy. This bill would go into effect upon publication in the statute book on July 1st, 2025. And I can stand for questions.
Very good. Thank you, Carly. Questions? Representative Ellis.
Thank you, Mr. Chairman. I must be slow, but I'm trying to. This allows rural emergency hospitals, which this was instituted about a year ago, to have up to 10 beds, swing beds. In the present one, they disallowed that if you applied. There are 3 hospitals, I think Arc City, La Crosse, and Mountain Ridge. They got affected by this. So they would be allowed to have up to 10 beds since they already previously had this. Is that correct?
Mr. Chair, Representative Ellis, that is correct.
Thank you, Mr. Chairman.
Representative Buehler.
I'm sorry, I didn't. Representative, could you repeat the question? I didn't hear the question. I want to make sure I'm clear on the answer. Thank you.
Mr. Chairman? Okay. About a year ago, there was a new program by the federal government called Rural Emergency Hospitals, and most hospitals were critical access. You could have swing beds. And actually, they make up to $4,000 per patient. It's a limited time for about 2 weeks. And that's where a lot of hospitals make their money. If you apply for this rural emergency hospitals, you get a set amount, but you can't have swing beds. There are 3 hospitals that jumped at this, Arc City, La Crosse, and Mountain Ridge. And then they found out that they couldn't have swing beds. They lose up to, well, our little hospital has 10 to 20. That's $40,000 to $80,000 a month. So they lost all that. This corrects that problem, and they can have swing beds now. I assume, is that correct? Thank you, Mr. Chairman.
Thank you, Representative. You did a great job of explaining that. So, and that's what this is meant to do, is correct that problem. Representative Blex.
Thank you, Mr. Chair, and thank you for this. Maybe the great representative can explain why KDHE is no longer able to govern this and is switching to the Kansas Department of Aging and Disability. I mean, does the licensing affect that, or just kind of explain that to me, if you would, please?
Mr. Chair, Representative Blex, that actually might be a question for a conferee, why that change was made.
I think where we run into the difference is that KDADS regulates skilled nursing facilities and KDHE regulates the hospital part. But I'll refer to somebody that knows a lot more than I do about that. Okay, thank you, Carly. Any further questions of Carly? Okay, very good. So we're back on 2249. Okay. We have our proponent Tara, I want you to know that we moved our entire schedule around just for you, so.
Thank you so much, Mr. Chairman, members of the committee. I am Tara Mays with the Kansas Hospital Association. Apologize that I had to be in higher education budget, which I don't get to spend a lot of time in a little bit earlier, but appreciate the opportunity to appear before you in support of House Bill 2249. I'm going to give you some context and maybe answer some questions that you all have been discussing with the revisor before you hear about the specific situation from one of our hospitals who will be joining us virtually. So just as a little bit of background, and I think you all have kind of discussed, the federal government allowed us to start what is called rural emergency hospitals in 2020, the very end of 2020. We were the first state in the country to pass state statutes to allow for rural emergency hospitals to be in place. So for those of you that were here for that, you might remember some questions from this very astute committee about the ability of rural emergency hospitals to keep skilled nursing facility beds. For those of you that were not here, I want to take just a minute to talk about what the heck is a rural emergency hospital and how is it different than other hospitals. A rural emergency hospital, essentially, a rural hospital who is struggling financially perhaps can change reimbursement models by converting to what is called a rural emergency hospital. What that does in practice is they give up inpatient beds, but keep their emergency room, and then they, as a hospital board, and with their community can decide, are there other services that are ancillary that they might like to keep? There has been a lot of discussion at the federal level about kind of can they have skilled nursing facility beds, but I want to spend just a little bit of time talking about what the heck those skilled nursing facility beds mean. Sometimes they're called skilled nursing facility beds. Sometimes they're called other things, swing beds. What that allows a hospital essentially to do is to take a patient for a small period of time, so a few weeks usually. Perhaps they've had a higher acuity, they've been in a higher acuity care setting and they've had a procedure, and they can go back home and recover. So they need some day-to-day care management, but they're only going to be there for a short term. So a lot of times the long-term care industry isn't necessarily interested in serving those patients because they're much more interested in serving patients that are going to be there for a long term. So these skilled nursing facility beds are really, really important for a lot of communities to be able to have patients recover closer to family, but also for a lot of our higher acuity hospitals, because they want those patients to be able to transfer to a skilled nursing facility and recover closer to home so that they can get a higher level acuity bed open for more procedures and patients that they can serve. So this is kind of a little bit about the continuum of care. I'm going to go back to kind of what are we talking about here. We have three, as you mentioned, rural emergency hospitals in the state of Kansas: Ark City, La Crosse, and Mound Ridge. Mound Ridge, as they were transitioning to become a rural emergency hospital, they had and opted to keep their skilled nursing facility beds. They wanted to be able to keep that service. The agency, this was the first time one of the hospitals was coming to them that was saying, we want to become a rural emergency hospital, we want to keep skilled nursing facility beds. So the agencies, KDHE and KDADS, kind of got together and said, okay, so what is this going to look like? Because anytime you start kind of a new program, it requires us to have conversations about who is now going to have oversight of these beds. And as the chairman mentioned, typically skilled nursing facility beds kind of fall more under that KDAD sides. But because these beds have historically been inside a hospital, they've always been kind of licensed under KDHE before. So the agencies got together and decided that they would prefer that KDADs go ahead and license the skilled nursing facility beds. In that conversation, which you will hear more about, essentially they were going to require our hospitals to have to make significant financial investments as if they were opening a brand-new long-term care facility. That would have required a pretty significant investment from Mercy Mound Ridge Hospital. So this bill just clarifies to the agency what is the legislative intent around if a rural emergency hospital is going to keep skilled nursing facility beds, should they be treated like a brand new skilled nursing facility, or should they have waivers granted to them because they've already been providing these services to patients for years and years? And so what we're asking for you in House Bill 2249 is to go ahead and provide some clarity to the agency that what your expectation is that when these beds are associated with a rural emergency hospital, that they grant a waiver so that they don't have to make significant financial investments as if they were a brand new facility. With that, we'd ask for your support of House Bill 2249. And Mr. Chairman, I'm happy to stand for questions at the appropriate time.
Committee questions. Representative Weichel.
Thank you, Mr. Chairman. So I just want to confirm that allowing the waiver so that they can have the skilled nursing beds doesn't jeopardize the reimbursement model from the feds.
That is correct. You would not be jeopardizing the reimbursement model for the feds. Allowing the waiver just says that that facility can go ahead and operate under the conditions, the same structural conditions that they're operating and serving those patients today, and not have to make upgrades as if they're a brand new facility meeting brand new codes.
Committee, further questions? I have just one, just to make sure that is just not for McPherson. This is for all the REH hospitals.
Thank you so much for that question. So this helps, as I mentioned, higher acuity level hospitals to be able to transfer patients. Any future rural emergency hospital that would have swing beds that are going to be under this kind of new licensure structure, we believe that this will provide clarity to the agency about how that would be handled in perpetuity. So it's providing kind of legislative intent clarity to the agency about how you want that handled.
So a follow-up is, so any of the REH hospitals that are already there, this is not going to affect them, or are they going to be able to provide swing beds?
We would hope, it is our hope and intention that the agency would, following the passage of this legislation, be able to grant a physical environment waiver to Mound Ridge Mercy Hospital so that that way they can continue to provide those swing bed services and skilled nursing facility services to the patients in their community.
But what about the other two REHs?
I suppose that if they were to go back and as a community decide as an REH they want to now provide skilled nursing facility services and get CMS approval for providing those services, then they would also be treated similarly.
Very good. Thank you. Representative Ellis.
Thank you, Mr. Chairman. Did Mountain Ridge have to give up their services for a year?
While I believe that you will be hearing from Mound Ridge Mercy Hospital very shortly, I do believe they've had to give up their skilled nursing facility services.
That is a lot of money to give up for a little hospital. Thank you. Thank you, Mr. Chairman.
Thank you, Tara. Okay, next we will hear from, if I can find my sheet here, Aaron, virtual. Aaron, are you there?
Yes, good evening. Can all of you hear me?
We can.
Okay. I appreciate the opportunity, Mr. Chairman and committee, to provide virtual testimony for this current House bill. And I just want to lend my support for the background that Sarah Mays with the Hospital Association just provided on the issue. It is an ongoing issue. In fact, I'm right now in Washington, D.C., working at the federal level to also help to correct some of the unintended consequences of some legislation around the rural emergency hospitals. But as Tara indicated, we were confronted with a cost that was estimated between $2.5 and $3 million to bring our 1969 block construction building into compliance with the building codes for brand new nursing homes. We would have basically had to gut an entire wing of the hospital, and the state agency was unwilling to even come begin a survey to allow us to continue providing skilled nursing services until we could demonstrate that we had our physical plant in compliance with the with those requirements. So our board made the difficult decision back in May to close that skilled unit entirely, and it does remain closed as of this day. Our hospital took an immediate about $500,000 financial loss, and that loss of services is ongoing, including the fact that we have missed out on a payment increase from the federal government that went into effect January 1 of 2025. So as these services continue to not be available, we're also not able to take advantage of that payment to provide those services. So we would appreciate the committee's support regarding this House bill and communicate to the state agencies that we would like this legislation intent clarified so that they can do the job that we need them to do. Thank you. And I stand for questions at the appropriate time.
Very good, thank you. Committee questions? Seeing none, thank you, Aaron, for being here. Okay, committee, I'll bring your attention to written proponent testimony from Kylie Childs, Director of Government Affairs, Leading Age Kansas, and a neutral from Lacey Hunter, Commissioner Survey Certification Credentialing from the Kansas Department of Aging and Disability Services. With that, I'll close the hearing. Sorry. With the committee's permission, I will open. Oh, she's here. Okay, sorry. Lacey, sorry about that. Welcome to committee. I'm so sorry.
Mr. Chair, members of the committee, thank you. I am Lacey Hunter. I am the Commissioner of Survey and Certification for the Kansas Department of Aging and Disability Services. Thank you for the opportunity to provide testimony today on House Bill 2249. House Bill 2249 adds a section to the Rural Emergency Hospital Act that would require the Secretary of the Department of Aging and Disability Services to provide a waiver to physical environment standards to any rural emergency hospital that meets the criteria described in the bill, allowing them to transition up to 10 swing beds, as mentioned before, into skilled nursing beds. Again, as mentioned, to receive the waiver to physical environment standards, eligible hospitals must be registered rural emergency hospitals and have been registered as hospitals before being registered as rural emergency hospitals. Eligible hospitals also must have previously provided skilled nursing level of care or have identified swing beds. House Bill 2249 would have little physical impact on KDADs and solidifies into statute KDAD's authority and responsibility to provide waivers to statute or regulatory requirements which had previously been unclear in legislation. KDADS is aware of only one rural emergency hospital that meets the criteria to request the physical environment waiver. House Bill 2249 would have no impact on providers unless the Center for Medicare and Medicaid Services does not allow for this newly created entity to be certified for Title 18 and Title 19 services. KDADS did not have regulatory authority over the facility that would qualify for a waiver under House Bill 2249 and does not have information on the utilization of the long-term care beds in the facility prior to its transition to a rural emergency hospital. Granting a waiver from the physical environment standards for a facility that meets the requirements of House Bill 2249 could allow the provider to continue providing long-term care services as it did prior to the transition as a critical access hospital to a rural emergency hospital. Thank you for the opportunity to provide testimony on 2249. I am happy to stand for questions at the appropriate time.
Very good. Thank you, Lacey. Committee, questions? Okay, very good. Thank you. Oh, Representative Rivas.
Yes, thank you for your presentation. So are there rural hospitals out there that haven't sought this designation? Because if they did, they would have to close their swing beds that they have now.
To my knowledge, no. I do have my partners from KDHE in the room here who would receive that application for designation for rural emergency hospital. But talking to them prior to this bill, they have no applications for any other critical access hospitals to make that transition. There are no pending applications for any more than the 3 that currently exist.
Thank you.
Committee, further questions? Seeing none, thank you very much for being here. Okay, I'll go ahead and close the hearing now on 2249. I'm going to open the hearing on 2219, or we'll work 2219 with the committee's permission. That would be the Physician's Assistant Licensure Compact. Second. Oh, I need a motion first. Motion by Representative Bueller.
Mr.
I need
Chair.
a second. Second by Representative Ruiz.
I move that we pass House Bill 2219, Physicians Associate Licensure Compact, out of committee favorably.
I have a motion. Representative Weichel.
Mr. Chairman, am I remembering correctly, there were some amendments proposed by a conferee?
Right. So we have the bill and a second. And now we're ready for amendments. So in that process, is there discussion? Yes, we would. Thank you. No, we're good. Committee, I need a motion to accept this amendment. To offer the amendment.
Oh, we need a motion. I make the motion.
Oh, I'll do it.
Okay. I have a motion. I need a second to accept the amendment. Representative Opeza, now we're back on track. Chairman's a little rusty at this, but good thing we have good staff. Carly, would you like to explain the amendment?
Thank you, Mr. Chair. On page 3, line 38, it will strike examination and insert by its licensing board receiving the results of a criminal background check. And then skipping to page 10, on line 31, it strikes contract and inserts compact.
Thank you. Committee questions on the amendment? Representative Turner.
Just for clarification, I think the conferee was William Wilk with the Kansas Chamber that said that these were things that were hit in the Senate side. Now we're just adopting similar here on the House bill, just to be clear.
I believe that is correct. Is that correct, Carly?
Mr. Chair, that is correct.
Very good. Further discussion on the amendments? All right, I have a motion and a second and discussion. Seeing none. All in favor of the, am I getting this right? All in favor of the bill, amended bill, say aye. Aye. Opposed? Same sign. Motion carries. Bill is passed.
That was the amendment, right?
As amended. All right.
That was passed.
Okay, now we need to pass the bill. Okay, I have a motion to pass the bill. Second by Representative Ruiz. Discussion on the amended bill. Seeing none, all in favor say aye. Aye. Opposed, same sign. Bill is passed. All right, let's hope I can get it together for more than one time. Okay, committee, I'm going to open the hearing on 2284, or I'm going to work 2284. Is there objections? Seeing none, I would entertain a motion. Representative Weichel?
I would move that we would pass the bill out of committee favorably.
Do I have a second? Second by Representative Ruiz. Discussion committee? Yeah. Representative Turner.
Thank you, Mr. Chair. I think this is a needed bill. There is one change I'd like to propose that I believe will be a very friendly amendment, if you'd like to hand out the amendment.
Thank you. And committee, this is a friendly amendment. Oh, I need a second for the amendment. Representative Rivas. Rivas. Okay, I have an amendment, and I have a second. Oh, Carly, would you like to explain the amendment?
Thank you, Mr. Chair. The proposed amendment would, on line 19, strike the period and add a semicolon and then include a parent 4, which would read, an appeals process. Appeal shall be overseen and adjudicated by an appeals committee. Such committee shall be comprised of the Senate President, the Chair of the Senate Financial Institutions and Insurance Committee, the Chair of the Senate Public Health and Welfare Committee, the Chair of the the Speaker of the House of Representatives, the Chair of the House Insurance Committee, and the Chair of the House Health and Human Services. It should read Human Services Committee. Apologies. The committee shall oversee and adjudicate appeals pursuant to this section in accordance with policies adopted by the Department of Administration.
Committee discussion on the amendment. Representative Weichel.
Thank you, Mr. Chairman. I think this amendment is in good faith, but I would like to raise the point that according to the people listed here that would be on the appeals committee, this would be all chairs or speakers. This would be a one-party committee. It would not have any ranking members or other designees. Is that the intent of the amendment?
Thank you for that. And who would you like to add?
Well, I might want a little bit of time to think about that, but I mean, I think that could be resolved relatively simply if we had a little bit of time.
We could correct this on the floor if we pass this bill out with a floor amendment. Actually, I think what we ought to do is probably pull this. Representative Howell.
Thank you, Chair. I just have a more rudimentary question. What are we appealing? Could the carrier of the amendment maybe just explain what is the purpose of the appeals process? Like what would be appealed exactly? Because I'm a little bit confused about that.
So in a process, there was a tie, for instance, with the two MCOs, and this would be a way to decide that. It ended up going to court and was quite a lengthy process, but this would be a process to, if that happened again and there was an appeal, that there would be a body of legislators that oversaw that process.
That's very logical. I looked back immediately at 3 and thought, why would we appeal that part? So Okay,
And that's what it's about. It's
okay. The tie break makes complete sense.
Representative-
Thank you.
Representative Lex.
Yeah, Mr. Chair, just a suggestion, we could include a ranking member of both Senate and House, the minority ranking member on this committee.
I think that would be good. Representative Weichel.
Mr. Chairman, if I may, I mean, I would be happy to work with the bringer of this amendment to craft a floor amendment if we feel like we want to push this out today that I think could be agreeable to all parties.
Yeah. The chair's uncomfortable with floor amendments. I don't care for them. They're not properly vetted. Why don't we just pull this back, work it, have Carly add some language, get with Carly and have her add some language. We can pass it out tomorrow if that's okay with the committee. I don't care for floor amendments. They just usually aren't properly vetted like a committee amendment is, so I would just prefer this. Am I doing everything above? Yes. Yeah.
I'd like to withdraw the amendment.
And a second, withdraw, so we withdraw the amendment, and then I'd entertain a motion to withdraw the bill until another time. Representative Gardner, and a second would be Representative McDonald. Okay, sorry about that mass confusion there, committee. Let's see if we can get this one better. I would open the hearing on 2249, the bill that we just heard. And I would entertain a motion to work that bill, 2249. Representative Bueller and Representative Ellis as a second. Discussion committee. Seeing none. Representative, you may close on your motion.
Thank you, Mr. Chair. I close.
You've heard the motion. All in favor, say aye. Aye. Opposed, same sign. Bill is carried. I think that might be, we got a little more time. I'm going to open up working 2307. Is there objections, committee? Seeing none, I would entertain a motion to work 2307 by Representative Berquist and a second by Representative Ruiz. Okay. Yeah, I will, yeah. I would offer an amendment for this bill. Oh, let's pass it out first. Amendment, and could I get a second? Second. Second by Representative Steves. Now we're good. Too much stuff going on.
You're getting your exercise today.
Amendment on that 2284. That's what I did. I want somebody else to do that. Carly, would you like to explain the amendment?
Yes, thank you, Mr. Chair. On page 3, this is just correcting a printer error. So on line 24, it would strike that term is. So the definition would read, healthcare provider means the same as defined in KSA, and continues on. Thank you.
Committee questions on the language of the amendment? Representative Ellis?
I just thought it was interesting. What is the meaning of is? Never mind.
Lawyers make lots of money off of that. Committee, further discussion? Representative Steins.
Thank you, Mr. Chair. So, no, I'm glad that this clarified a little bit because when we were talking about developmental disabilities, I know we talked about Down syndrome, but I know there's other disabilities too. I was just going to make a comment real quick that I had a friend who had a baby. She had hydrocephaly, same situation. She didn't have anywhere to go and was told, that there was no hope. And so later, Augie, my godson, was born, and he's able to do everything. So swallow, learn, and everything. He graduated from high school last year and is now in college. So it's just a really great story. So I think that this is really needed for those people who don't really have anywhere to go and they're not sure. When you're told that and you're pregnant, it's a very scary situation. So, and I wanted to thank Lola because I think she is a rock star. So, thank you.
Thank you, Representative Staines, for that. Committee, further discussion? Seeing none, I have an amendment.
No.
All in favor of the amendment? Aye. Say aye. Opposed, same sign. Motion carries. Now, is there discussion on the amended bill? Seeing none, all in favor say aye.
Aye.
Opposed, same sign. Oh, I need a motion to pass out the amended bill. Okay.
Okay. Mr. Chair, I move that we move out 2307 as amended.
Do I have a second? Second by Representative Howell. Now, is there discussion on the amended bill? Seeing none, all in favor say aye.
Aye.
Opposed, same sign. Bill is passed. I think for my sake today, I probably ought to just quit right there. So, committee, we will work 2159, if you remember, that's the Narcan or whatever bill, and we will also work 2217 tomorrow. So, with that, we're adjourned.